Hello again, I'm Dr. Yash. In this chapter, I want to talk to you about something that lies at the very heart of diabetes management: blood sugar control. Now, why is this so important? Because keeping your blood glucose within a healthy range can dramatically reduce the risk of serious complications, things like nerve damage, kidney disease, heart problems, and stroke. Let's break this down. Glucose, what we often call blood sugar, is actually the main source of energy for the body's cells. But in diabetes, because the body cannot use insulin effectively, glucose tends to stay in the blood instead of being used for energy. And when blood sugar remains high for too long, it slowly damages your organs and tissues. The American Diabetes Association, ADA, has given us some clear targets. For most adults with diabetes, blood sugar before meals should ideally be between 80 and 130 mg/dL. And about 1 to 2 hours after starting a meal, it should be less than 180 mg/dL. Sticking to these ranges significantly reduces the risk of complications. Now let me share some fascinating research with you. Studies like the DCCT for type 1 diabetes and the UKPDS for type 2 diabetes showed that for every 1% drop in HbA1c, that's your average blood sugar over the last 2 to 3 months, the risk of eye, kidney, and nerve damage can be cut by up to 40%. Even more impressive, good blood sugar control lowers the risk of a major heart event by more than 20%, and the risk of heart disease or stroke by as much as 57%. These numbers really show us why controlling blood sugar is not just important, it's life-saving. So how do we achieve good blood sugar control? It's about following a few key pillars. Monitoring. Regularly checking your blood sugar helps you understand how your food, activity, and medication are affecting your body. This can be done through fingerstick tests or continuous glucose monitors, CGMs. Diet. A balanced diet is crucial. That means foods rich in fiber, fewer refined sugars, and an awareness of the glycemic index of what you eat. Smart meal planning can go a long way. Exercise. Physical activity helps the body use insulin more effectively, controls weight, boosts circulation, and even lowers stress. Just 30 minutes of moderate exercise most days of the week can make a real difference. Medication. For many people, diet and exercise aren't always enough. Medications, including insulin, may be necessary. And here, consistency is key. Taking your medicine exactly as prescribed is crucial for stable blood sugar control. Education. The more you understand your condition, the better you can manage it. Education helps you make the right adjustments in your daily life, whether it's about food, physical activity, or medication. Of course, I understand that maintaining perfect blood sugar levels isn't always easy. Many things can cause fluctuations: stress, illness, hormonal changes, even poor sleep. That's why flexibility and awareness are important. On the other side, there's also hypoglycemia, low blood sugar. This is a short-term but potentially dangerous complication, especially for those on insulin. If you ever feel shaky, dizzy, confused, or irritable, that's your body telling you it needs fast-acting carbohydrates, like glucose tablets, fruit juice, or even a spoonful of sugar. Responding quickly is essential. So, to sum it all up, controlling your blood sugar is about more than just numbers. It's about protecting your future health, preventing complications, and improving your quality of life. With the right strategies, consistent effort, and proper support, you really can take control of your diabetes and live a healthier, active, and fulfilling life.